As nations across the UK talk about their plans for more freedom from Monday, it's been revealed that many millions of people are planning on deleting the NHS Test and Trace app from their iPhones, simply to avoid being told to self-isolate.
Well, this comes as the number of people being asked to stay at home by the NHS Covid-19 app has surged by tens of thousands over the past month. It's no surprise, is it? Because we know that infections are going up. Research reveals that 1 in 5 adults are now planning to delete it altogether. Well, should it stay because it serves a purpose, because it protects all of us? Or should it go because it doesn't take account, for instance, of the fact that if you've been double jabbed, you may not need to self-isolate. Joining us now, Dr. David Strain, Senior Clinical Lecturer at the University of Exeter Medical School, says, do not delete the app. It protects others. But Luke Johnson is chairman of Gales Bakeries. He says it's ridiculous and would advise people to delete it. Luke Johnson, in your business, what proportion of people would you say are off, not because they have COVID, but because the app has pinged them, in which case they might not even know who they've been in contact with who's tested positive?
Well, I would estimate it's at least at any one time 10% of staff. And I know that in a number of companies, it's nearer 20%. And of course, the number of staff self-isolating in the NHS is such that the NHS itself can't function properly.
Well, if they were infective, then that would be the right thing. But you say that that isn't necessarily the case at all. In fact, you've described the app as, and I quote, ridiculous. Can you explain what you mean? Why is it ridiculous? That's a strong word.
Well, one of the things I fail to understand is why Britain is testing more than virtually the whole of the rest of Europe put together. What's the purpose? The vast majority of people who are being forced to self-isolate and not displaying any symptoms and are not what we would call ill. And they are very unlikely, most of them, to be infectious. All this is doing is creating chaos and anxiety. To what end?
Well, let's add to your bundle of argument as we go to Dr. David Strain, who thinks we should be keeping this app on. Mandy from Twitter, Dr. Strain, says, track and trace app is ridiculous. I've literally completed my 10th isolation after testing positive along with my 2 daughters because one of my daughters updated her app. I'm now meant to isolate for another 3 days and our neighbours having to isolate without any contact with anyone that they can think of. So if you don't have faith in something like this, and obviously public faith in the app is clearly crumbling, it's not going to work, is it?
It is difficult when we lose public faith, but if we just look at the simple numbers, so far, it's estimated that the app has prevented 600,000 deaths within the UK. And that's based on the original wild type and the alpha variant. That is just because it's identified people at the right time and asked them to self-isolate so they didn't spread this any further. And that's based on the old variant. The Delta variant is about twice as infectious, which means, theoretically, we could be saving more lives.
OK, sorry to interrupt, but Dr. David Strain, the app doesn't take into account other mitigating factors, does it? I mean, when you get pinged by the app, you can't say, well, actually, I was wearing PPE, I was wearing a mask, I've been double jabbed. In fact, that person was my neighbour living across a wall. We haven't had any contact, because you don't know who is the person who's tested positive that you are being pinged as a result of, and you can't communicate those mitigating factors.
No, you're absolutely right, Susanna. But the thing about the app is, firstly, it has only ever been an advisory. Actually, within the health system, we advise all of our staff to turn the Bluetooth of the app off as soon as they put on their PPE. Because when you are fully protected with your PPE and your face shield, you actually don't need to be test and trace, because even if you do come in contact with it, as many of us do in our daily practice, it doesn't matter if you are fully protected.
What if you had
the problem is we don't know who it is that you've got it from. And if you have been out and about, then it could be very real, and you could then be spreading it before you have symptoms.
What if you had the double jab? What if you've had both jabs?
So the latest variant of the virus, the Delta variant, can infect 7 people for everybody who's infected if you take away all mitigation. So if you take away the mask and the distancing and the jab, it can potentially affect 7 other people. the vaccine will stop it, but reduce that by about 2/3 and reduce the risk of going to hospital by 94%. So it actually does its primary job of stopping people going to hospital, but it only stops you catching it by about 2/3, and therefore the risk of you spreading it by about 2/3. 7 people reduced by 2/3, which means 2 of those people you come into contact with that are double jabbed could potentially get it and spread it on. And this is all about protecting people going forward, particularly those who are vulnerable, the people in that very small 6 or 7% that the vaccine will not keep them out of hospital and will not stop them dying.
Did you say that within the NHS, the advice is to turn it off?
As we walk onto our COVID wards, when we put on our protective masks and our visors, we turn off our Bluetooth. Then as soon as we leave that, we take the masks off, we go into areas where we are not protected, then we turn it back on. And that is to be expected.
Well, one more point before we come back to Luke Johnson to see if anything that you've said has in any way altered his position on this. We've had so many messages from people saying that they've got pinged sometimes 6, 7 days after the point of contact, and therefore they only have to isolate for, say, another 3 or 4 days. And they're saying, what's the point? If I've already been out and about and socialising to the death for the last 6 days, why isolate now? Surely, if I've spread it, the damage is done.
The app can only ping you when the person you are in contact with, it updates the app that says that they have tested positive. Very often, it is 4 or 5 days before they even know that they've got it. And you are at your most infectious from between day 4 to 5 up to day 8 or 9. And probably the most infectious period on that day 6, 7, and 8, when symptoms do start to display. So actually, even if you do get pinged at the last minute, that is still enough time to stop you spreading it on.
Your answer to all these people who are saying, what's the point, is there is a point, and actually, when you get that message, even if it may be up to a week later, you're still you're more infectious than you were on day 2 or 3. That's interesting. OK,
Luke Johnson, it serves a purpose. It's preventing infections. The only people who should be switching this app off are NHS workers who are going into COVID wards. Does any of that change your mind?
None whatsoever. I find it very difficult to take seriously your other speaker when he says things like, the app has saved 600,000 lives. It's just fantasy. He can't possibly know that to be true. A great deal of what he said was false certainty. Like so many of the so-called experts dealing with this illness, he has the illusion of control. If people like him have been so sure of everything, why has Britain done so poorly in terms of its outcome overall? And why are we testing more than the rest of Europe put together? Has every other country got it wrong? And we're the only country who know about the app and test and trace.
Well, because we're running out of time, Luke, I just want to press you on the point about your business. What is your advice to staff working at your company with the app? And if they get pinged and told to isolate, what do you say to them?
Obviously, we have to abide by all the rules and we follow the law. But the fact of the matter is 800,000 school children are currently excluded. Does that make sense? It's arbitrary, it's incoherent, and it's causing enormous stress and unhappiness in society, and it makes no sense whatsoever. But
I think the thrust behind that question was, are you actually telling your employees, formally or informally, just to switch the app off?
No.
That's up to them.
Because we obey the law.
OK.
And Dr. Strain, what do you make of what Luke Johnson says about, how come if all these measures are supposed to be working, we're in the position we're in?
So there's a few different elements of that. Sorry, I do apologise if I said 600,000 deaths prevented. It's 600,000 cases prevented, 8,000 deaths.
Well, that's a very important clarification.
Sorry, there is the current conversion rate from being pinged positive to actually demonstrating you have COVID is somewhere between 6 to 8%. So that means for every 11 people that ping, 1 of them will have it and potentially spreading it. And actually, to answer the main thrust of the question, we are blaming the app when it's not the app's fault. There are 40,000 cases per day. Blaming the app for the number of people getting pinged is actually like blaming the sellers if the tax suddenly goes up, if Rishi Sunak put the VAT up by 40%, do you blame the market keepers for the prices going up, or do you blame where it comes from?
Well, we'll leave that question hanging. We'll leave that question hanging in the air because, as we say, we are out of time. But thank you for clarifying that slip of the tongue. We all make them, and we understand that. Thank you.
Yeah.